Well, thank you everyone for surviving to this point, to the point of the final roundtable of the 2021 THEC conference. I think we've had a fantastic time. It's been a lot of hard work behind the scenes, but thank you to everyone for taking part and for contributing to the success. We've had over 450 people register. We've had 83 speakers. We've had 105 organizations represented. We've had people from 28 countries. And interestingly, 63% of delegates are from low middle income countries, which reminds us, by the way, of why we're sticking to running conferences online. Because in terms of accessibility, that is a fantastic bonus for us. We really value the perspective and the expertise of our colleagues in low middle income countries. We're grateful to you, particularly for joining us and for guiding our thoughts and decisions. And of course, I've just come from this wildly stimulating session on climate crisis. And we're 3 weeks away, aren't we, from COP26? So that's also a reminder of why we rise to this challenge of dealing with the technology and the challenges of internet connectivity to run this conference online. I'm now joined in this final roundtable by 4 rather brilliant people who I have a lot of admiration for and who bring very different perspectives. Dr. Sonia Akrimi from the Global Anesthesia Development and Partnerships project. I admire you, Sonia, for your Twitter life. If anyone in the audience is not following Sonia on Twitter, then they need to. Sonia, you have expressed with brilliance the sense of outrage that I think many of us share about the inequality of access to vaccines, and your insights, particularly into what's happening in Zambia, have been very, very impressive. Marcus Wotton joins us from the Royal College of Pediatrics and Child Health. Marcus has played a distinguished role in our response to the coup in Myanmar. This is not the only thing he does in life, but his work to establish a medical education website to reach out to the nursing community, particularly in Myanmar, has been nothing short of inspirational. Thank you, Marcus, for your work. And Dr. David Musoke from Makerere University. David, it's fantastic to have your contribution. You are a distinguished academic, a distinguished member of our community, and we're very grateful to you for joining us. And finally, I have my colleague for 1 year only, Lisa Kelly. Lisa is on secondment from Nottingham University's hospital, and she is enriching the life of THET. She is passionate about a globally engaged NHS, about the value of operating internationally, about the benefit that NHS staff can derive from having that global perspective. She's done it herself. And she brings it into her career within the NHS. And that's a very distinct perspective that Lisa's also bringing to this roundtable. So thank you, Lisa, for joining us on this occasion, but also for the work you're doing with us at THET. So we're going to keep it conversational. I've got 2 basic rounds of questions. The first question is a kind of reflection on the conference. We've just been reflecting how much of it we've been able to see because it's recorded, it's online. So we've been dipping in and out at different times, as well as watching things live. And then the second round will focus on the future and try to draw wider lessons for health partnerships. So I'm going to throw myself in by starting with you, Sonia. As I said, you've championed the need for greater vaccine equity. Do you feel the conference has communicated that sense of urgency that needs to be communicated at this juncture in global health?
I really do. One of the things I think I've enjoyed the most is hearing how often this has been discussed in the conference. And it's not only been the speakers or panelists, it's come up repeatedly in questions afterwards. And I think that shows that vaccine inequality and the impact that that has on global health in this pandemic is actually at the forefront of all of our minds and is very shared between us in our views on what we would like to see change.
And for me, the moment was Dr. Tadesse, I think, the Minister of Health from Ethiopia, when she said in Ethiopia, access to vaccines is less than 3% compared to over 80% here in the UK. But Sonia, you've been particularly looking at this from the lens of Zambia, haven't you? Tell us more about your work in Zambia and what you've learned during this period of pandemic about what's happening in Zambia, please.
Yeah, absolutely. I think also I share, first of all, your reflections about Dr. Tadesse and what she said on the first day. And similarly, Dr. Tedros, he referred to it as epidemiologically self-defeating, this vaccine inequality. And I've used that phrase, I think, about 5 or 6 times already since Thursday. But I really like that because we know that we disagree. We feel that this vaccine inequality is unethical. We feel that it is inhumane. But the fact that he described it as epidemiologically self-defeating for me also shows that there is a science to it. And it's not just about humanity, that's enough. But it's not only that, it's about pandemic management. And if we don't vaccinate the entire global population, we are going to continue to have outbreaks, we're going to continue to have variants, and they will work its way to our health system in the UK as much as any other health system as well. So I really like that phrase because it brings the scientific basis of pandemic management to this concern as well. And I feel personally, on reflecting about what we've tried to do as an organisation ourselves and what I've seen so many other organisations do, is that there's been a lot of lessons learned. We felt as a partnership that advocacy was one of the things that we'd done before, but we really learn now actually that we hadn't really delved into that area as much as you can do, and we hadn't learned as much as the pathways, as what pathways exist for communicating messages like this. I think it's really important that we keep doing that. Some of the reflections and things that I have personally learned and have thought about a lot through this conference have been, first of all, the importance of standing together as a group and stating your position on an issue, for example, vaccine equity, firmly. And I think that's really important for your partners to see so that they understand and that your views as an individual and where your organisation stands might be different to what we see politically. I think that's really valuable. The second thing that I think has been really useful that I personally had never done before and has been a huge learning curve is reaching out with other organisations, including the press, and making connections and repeatedly trying to meet people and to spread the word. And I found the journalists that I've never worked with journalists before, but journalists that I have worked with, I have to say, have been fantastic, and particularly Channel 4 really helped us communicate this message. Additionally, a lot of other NGOs and collaborations and coalitions that we spoke with and worked with really helped as well. And the third thing that I've learned as well is the power of the personal story, and that even if you're communicating the message to thousands of people, it's actually how the story affects an individual that really grabs us. And that can be very difficult to do with bearing in mind psychological safety and that individual safety. We've got lots of examples of healthcare workers who have passed away from COVID-19, of healthcare workers who've been working on the front line when somebody very close to them and their family has caught this infection and has died from it. Also examples of healthcare workers working under the most extreme, unimaginable, constrained circumstances, but being very afraid to say how difficult things are, because they want to reflect in their message that they know that their hospitals and their ministries of health are doing what they can, but still that's not enough to be saving as many lives as we could save. I think that is the final thing that I've really learned, the importance of communicating the personal story, but doing it in such a way that those individuals are protected.
Thank you, Sonia. And did you see Victoria's session? I thought that was one of the best. Victoria McDonald, the Channel 4 health correspondent. I think that's one of the best on Friday morning. By the way, we too think the voice of health workers in advocacy and campaigning is terribly important. Head across to our website and see the HEAL campaign.
Yeah.
I know Marcus might pick up on that as well later. David, I should be asking you about vaccine inequality on the grounds that you're sitting in Kampala, where you have less access than we do here in London. But I want to ask, by all means, comment on that. But I want to ask you something about the academic links, because that's very important to the vision of our founder, Professor Eldred Parry, that ability to learn from what we do, to partner with academia in order to improve the way we do things is just core to our being. And so my main question is about, have you seen those academic links celebrated enough in this conference?
Thank you very much, Ben. And the answer to the question is certainly yes. Over the past 4 days of the conference, we have seen academia involved in partnerships probably more than before. And it has been very evident in some of the partnership work, especially supporting, for example, nursing in Zambia, or work we've seen, heard about today in Bangladesh, but also the vast work being done in Myanmar. And we've seen that indeed the partnerships are not only involving the health practitioners, but also academics actually involved. And this is something that I believe is the way to go. And I'm really pleased that TED has a very keen interest in this. And I think it's also become evident, as we've seen in many of the works over the past so many days, that nowadays practitioners are also more involved in research as part of their partnership work. And as you will recall, many years ago, a lot of partnerships were more in health service delivery, including strengthening health workforce. But now we've seen partnerships actually take active engagement in research, whether it's part of their core partnership activities or as part of their evaluation of their ongoing projects and programs. And we've seen, for example, in this conference, partnerships engaged in qualitative research, quantitative research, but also mixed methods research as part of their evaluation, but also their core practice, which I think for me is great to see. Probably much more should be done. And I think if we also do more research, also engage academia more, we shall find that some of the findings from these initiatives can also inform what we do in terms of practice. So we've seen, for example, some partnerships using some of their research findings to actually inform their next step of action, which I think is the way to go. And we hope to see more partnerships work more closely between the academia and the practitioners. And I think this is something that has come strongly in this conference. And I'm sure I will develop more as we go along.
And thank you to you because you talked about the partnership with Nottingham Trent University as well, didn't you? Which is your long-standing relationship. How long have you guys known each other now?
Well, we've been working together for over 10 years. It should be about 12 years now. But over the years, we've also come to realize that indeed we can't work on our own academia. And in most of our recent partnership work, we have actually involved practitioners both in the UK and in Uganda. And this emphasizes the fact that indeed there should be close collaboration between academia and health practitioners in strengthening health partnerships moving forward.
Yes, it's absolutely wonderful. So over a decade of partnership, which is also one of the crucial ingredients we value, isn't it? We like to think that, that longevity of relationship leads to a more honest relationship, or a relationship where partners can be more confident in each other's company. So, if something isn't useful, it can be said without offense being taken. Do you think that's true?
Absolutely. I can't agree with you more. And if you look at the way we worked as a partnership between Nottingham Trent and Makerere 10 years ago and now, I think things have evolved and trust has actually been built over time. And this is something that requires certainly time. I don't think partnerships can, achieve and be as open and as flexible and as understanding as we are, having worked for over 10 years. So I totally agree. And more time working together, it means understand each other more, You also know how best to work with each other. You know each other's strengths and weaknesses, but also know how to handle situations better. It may require, partnerships to think beyond what they normally do, but ensure that all those involved are working on the same page for the benefit of the partnership and for the health systems being supported.
Thank you, David, and thank you for that partnership and for your work and your contribution to this conference. Lisa, Nottingham, of course, the city you know well, but the question I want to ask you is, to what extent do you feel optimistic about UK institutional support for partnerships? Obviously, we're emerging from the brutal cut in UK aid, and yet we've seen really interesting contributions from Health Education England and from DHSC at this conference. Does that make you optimistic about levels of support for staff to engage in institutional health partnerships?
So there was a moment then back in April, I think I was 3 weeks into the secondment, and I thought this was going to be a very short secondment when we had the dreadful news from FCDO that they were cutting that programme. But despite that, it has been incredibly humbling and an absolute privilege to work alongside colleagues at THET and more broadly across the health partnership community to see how we've adapted and responded to that. And I think this the contributions we've had at this conference are testament to that. So kicking off on Thursday with the Chief Medical Officer, with Chris Whitty, I mean, he couldn't have been more. I think he talked about admiring the achievements of healthcare workers globally, but specifically the work that health partnerships have been doing with the support of THET. So improving health systems, health outcomes, despite the situation we find ourselves in. So what better accolade could we have than that? And similarly, long-term supporters and partners of THET. So Jed talking so passionately yesterday, and I love his idea about health institutions and systems having global KPIs. Brilliant idea. How do we land that? But also Tom Hughes from Health Education England as well, talking about Global Britain and helping us unpack what does that really mean and what's our contribution. I think also colleagues from Scotland, so Liz Grant, and then from Wales, Jane Hutt, demonstrating that actually we are a UK-wide organisation and our health partnerships stretch the span of the UK. And my goodness, what England could learn actually from some of the work around sort of global citizenship. To then very new voices or new relationships. So our Chief Midwifery Officer, Jacqueline Bentley-Dunn, sort of lending her support to our work around diaspora, and the new relationships we've been building with Gail Marzetti at DHSC, some of the opportunities around workforce that's enabled us to perhaps follow up on some of those FCDO programs that we thought were no more. And then particularly in the areas I've been leading over the conference, we've had the pleasure of Steve Lee, who's Head of Wellbeing, NHSE, and Emma Wadey, who works out of the Chief Nurse's Office. So we've had a real span of very senior people from UK institutions supporting us over the last few days. So I am optimistic, but with a level of caution. So I think that there are still people who don't recognise the mutual benefit of working globally, and we still have some work to do to build that evidence, to make sure we're speaking the same languages. So whether that's about talking about retention or sort of world-class goals that organisations might have in their trust strategic plans, whether that's how we talk with the NHS about the kind of cultural awareness or the diversity ambitions they have. I think we need to continuously be thinking about how we're engaging with different parts of the UK health systems. So yes, very optimistic. And you, the health partnership community, are our biggest asset and our biggest advocate. And we need you to continue doing the wonderful work you've demonstrated over the last few days to continue to influence decision makers in the UK.
Lisa, thanks so much. And thanks for reminding us. I just realized Chris Whitty spoke at our conference, and it felt like he did that last month, but it was only on Thursday, and here we are on Tuesday. But it's just a kind of tribute to how long the conference has felt. It's a wonderful list, though, of people that you've reminded us of who have contributed to this conference. Some of whom, of course, you persuaded to come along. And it does make me optimistic. I also like the point you make about the UK charity. For those of you who don't know, and I'm sure there's no one who doesn't know this, but the UK is 4 nations. And the way in which the NHS is organised across 4 nations is very different. And that's a strength. And it's reflected in the way global health opportunities are organised across the UK. And that's a strength, because we can learn from each other. And there are good ideas happening in different parts of the United Kingdom, aren't there, which we're able to draw on at FET and use in our advocacy and our work. Thank you so much, Lisa, there. Marcus, this is the International Year of the Health and Social Care Worker. My goodness, and it follows, of course, 2020, which was the year of the nurse and midwife. And yet you, particularly in Myanmar, but elsewhere, I'm sure, have witnessed unprecedented pressure on nurses and midwives during this year. To what extent do you think the conference has acknowledged that? And has it helped us in our thinking, do you feel?
Yeah, absolutely. So I think what's been really interesting about this conference has been the focus on the workforce and on the multidisciplinary team. And I think a conference like this, which has focused so much on that collaborative working, shows us in many ways how far we've come, but also, to be frank, how far we still have to travel. And for me, this type of international health system support has lagged really far behind the work that doctors, nurses, health and social care workers do in their everyday practice, which is actually very close into professional working. And so the challenge for us, I think, as a health partnership community is to make sure that we're mirroring that level of professional interaction and coordination. I think for too long, we've all existed in professional silos, and in some ways, we probably still do to a degree. And I think the challenge for us going forward is to think about how we break out of those silos and come together most effectively. I think where this conference has really demonstrated that, it has shown that interprofessional working can be really far more effective than the working in silos. And I think one of the things I would highlight actually that I've really noticed by its absence has been some of the phrasing that I think you find in other conferences, sometimes in other discussions, which alludes to a lack of professional respect. I haven't once at this conference heard somebody describe a doctor or a nurse as a lower cadre of health worker. And yet that is the sorts of language that you still hear quite a lot. Nobody is a lower cadre of health worker, nobody at all. And in fact, if this 2020 year and the year that we've just had as well, which shows us anything, it shows how important every single member of the healthcare team is. And to go back to the point about the year of the nurse and the midwife, clearly it was not the year that anyone anticipated. But actually, I think some people might argue that in fact the nurse and the midwife year was sunk by the pandemic. But actually, I think it gave everyone, including the general public, a really much greater appreciation of the fact that nurses and midwives and health and social care workers are not some optional extra that you kind of tack onto the side of the health system, but they are the engine room, and through them comes most healthcare delivery going forward, and that is a fact. And I think, how does this conference help? I think the first thing it should do is promote all of us to redouble our efforts in that regard, to think about how we work and how we break out of the silos that are sometimes we find ourselves in, to consider other people within the health system. And I think the work in Myanmar, we can talk about that in a bit, but that I think has definitely proved that. And then the other thing is about looking after each other. And I love an abstract, and I was really drawn to the abstract that was written by Celia Ngunda on the mobile phone app psychological support. I thought it was a really interesting project. I'm going to try and get in touch with her and find out more about it, because I think it was a really interesting idea on how best we can look after the workforce. Because not only do we need to think about the training and the development of staff, but also on the retention. And I think that may well be the challenge for the years to come.
Yes, thank you so much. And of course, we had Elizabeth Iro speaking, and that's exciting, isn't it? The first chief nursing officer at the World Health Organization. Yeah,
absolutely. And that is a fantastic element. There is a sadness in me that we've got to the age of, the year of 2021, and this is, these posts are now being put in place, and you think, why hasn't that been in existence since the 50s, frankly? But conferences like this help to push that agenda forward, and I think that's only a positive.
Yeah. No, thank you so much, Marcus. And when you were talking, I was thinking back to Louise McGrath's presentation on the first day. Louise had to speak after Chris Whitty and did brilliantly. But what Louise was doing was retracing, in some respects, the experience of THET and of health partnerships over the last year and 18 months. And I think what she captured were some of those moments of doubt. When COVID happened, we had a moment of doubt. We can't travel. How can we stay relevant? When the coup in Myanmar happened, we had a moment of doubt. We can't travel. We can't cope with conflict situations. That's not the context that health partnerships normally work in. And yet, would you agree with me and with Louise that there's a newfound confidence emerging from pandemic and coup, and indeed aid cuts, about health partnerships? A sense that the relationships that I was talking about with David previously, the relationships prove the value or ensure the value of continued information exchange, regardless of coup and pandemic. Do you feel that?
I'm going to say absolutely, and I mean that absolutely. I think one of the great things about this conference has been the two words that you started with, which was solidarity and resilience. And I think that can apply absolutely to health partnerships. I certainly speak from the Myanmar work that we've all been doing. Had those health partnerships not been in existence prior to COVID and prior to the coup, we would have found ourselves completely lost as to how to offer practical support. I think with the word solidarity, I think there's a real inflexibility in our language around the word solidarity, because I think sometimes one can view the word solidarity as, dare I say, a bit wishy-washy, a bit kind of, oh, well, we'll just be in solidarity with you. And actually, I think that the last year in Myanmar has brought us towards a much better definition of what the word solidarity, a definition that I could sign up to, which is that we use that solidarity, but we offer practical support and help. And I know Louise talked about this in her talk as well, that we are there not only to say, isn't this awful, but actually to work right alongside people virtually at the moment, and offer practical ways, veer away from the warm words and towards practical help. And I think that's been really inspiring and great to be a part of. I think it's not the full ticket. I don't think you can do full health partnership works on Zoom, because I think there are elements of being in the room with someone and standing next to them physically that do make a difference. But there's no question that the technological advances of even the last 3 or 4 years have meant that we can pursue a lot more of the work that we would have once done in person virtually, and it's been a really great honor to be part of that work. And then in terms of resilience, we've talked about the really savage UK aid cuts, we've talked about the coup, we've talked about COVID, but one of the things I think that the health partnerships have started to do much more effectively is work together, where we have seen streams of development. Now I hope that what we see, and the example of Myanmar I think is a really good one, of where those partnerships start to come together. And I've, in the work that we've done, I've met loads of people from loads of different health partnerships that I'd never really worked with and worked before. The GPs, the physicians, the emergency medics, all sorts of people. And actually, I think that's where partnerships, for me, need to go next. That multidisciplinary working needs to extend right across the work that we've done. And yeah.
That's great. And we're part of, aren't we, a network of something like 30 organizations, I think, who are contributing to the response to the coup. And we're still, by the way, looking for recruits. And there's an event on November the 27th, which will be led by the Myanmar diaspora community and the Myanmar UK Health Alliance. But that will be another opportunity for those of you who want to engage to take part. Myanmar has been a theme throughout this conference, and how could it not? This time last year, we were hearing a wonderful presentation from the Minister of Health. And now we know, what's happened, and the whole sort of calamity of the coup and what has been visited upon the Myanmar people is absolutely devastating. I'm very proud of the fact that we've had so many speakers from Myanmar contribute to the conference, including Dr. Sri Thura, who spoke in one of the opening plenaries. Marcus, I can't let you go without you telling me one story, which I know, but I think others need to hear,
No.
which was you started off those webinars for nurses, and my understanding is you have 4 people turn up, and then over weeks, how did it evolve?
Well, so initially we had 4 people turn up, which was a bit disappointing, if I'm honest. One of the reasons that we discovered that this was a problem was because mobile phone data, people were starting to run out of mobile phone data. So I got in touch with a company who bought people mobile phone data. You type in somebody's number and you buy the mobile phone data. And I said to them, can you do batch purchases? And they said, yes, we're thinking about doing about 10 by Christmas. And I said, well, I need 850 by August. And there was one of those silences on the phone where you think you're not quite sure where this conversation is going. And thankfully, we've been able to do that. And so there was one famous morning when 850 nurses woke up to find their mobile phones were full of credit. And why does that matter? It matters because it allows them to look at the protocol website, to join the educational work that we're doing. And we now get about 600 sometimes nurses on a Zoom call or following up on Facebook afterwards, and that work is continuing despite all of the issues. They are a remarkable group of people, and what is happening to them is absolutely appalling, and the world should be very alive to the fact that health workers within Myanmar are under the most enormous pressure. We've heard this for the last 4 days, but I think an action from this conference needs to be that we all need to think about how in our own different ways we can support health workers across the world, Myanmar and in other places that are subject to this kind of oppression, because it's not a world that I particularly want to live in if it's in that context, and we need to do all we can to stop it and make sure that we support them.
Thank you, Marcus. And you have a lot in common with Sonia, and it's not just coup, is it? It's the crisis of pandemic, which has so badly affected health workers. I remember talking very early on to Eunice Sinyemu, who's our country director in Zambia, talking about increased rates of suicide amongst nurses who felt they were unable to respond to the needs of their patients because of a lack of equipment, because they felt personally unsafe. And Sonia, you've been at the heart of that, raising awareness of that. And looking forward, we've talked about big and small themes across the conference. What do you think the health partnership community needs to focus on in the months to come?
I think there's a lot to focus on, and I think that's a credit to health partnerships. I really do think this is the time of the health partnership, and that's the biggest thing that we can learn at the moment. I think we need to be we need to make sure we share our learning. There's so many little things that we have all learned along the way, particularly in this crisis, about how we have been able to work together, how health partnerships have been able to repeatedly adapt. And I think there are very few organisations that have managed to adapt as many times as health partnerships have in the last 18 months. And what we've learned from that, and to share it between each other. From this conference, I've heard lots of examples of things that people have said they've done that I've thought, oh, actually, yes, that's worked really well for us. Or things where I thought, actually, we haven't tried that. I think we need to get our lessons down on paper and communicated between us so that we can continue this. For example, one of the things that has come up, I know that Louise mentioned it, but it's been mentioned more than once, is that we've seen a lot of leadership of projects because of the fact that UK volunteers haven't been in low and middle income countries as much in physical presence. We've been there to remotely support and mentor. And how have we managed that? How have we managed to see such an increase in the local leadership of a project, whilst also managing the fact that capacity and capacity has really dropped in this pandemic, and there are so many lessons around that. I also think, and it's again been mentioned in this conference, about the fact that the spotlight needs to remain on the things that were global priorities before this crisis happened, because they have really been affected by COVID-19 as much as anything else. Imagine all of the healthcare priorities that were already struggling in resource and were considered the most important things by our partners before March 2020. They've all regressed, sadly, because of the change in economy and health capacity that we've seen. And the spotlight needs to really stay on those as we continue to manage this crisis.
And I was just thinking, Dr. Sham Said's so good on this, isn't it? That's why we have him at our conferences, because he's waving the flag for quality UHC and asking us not to forget those essential services that you've just highlighted whilst responding to the pandemic.
Absolutely. We've seen it in previous epidemics. It was seen in Ebola that other areas of healthcare fell, but we've seen it in this already, and it's going to continue to happen. It's not just the change in health, but it's the change in economy as well that this has come with, and healthcare worker exhaustion. And that links in, I think, with the third thing that comes to mind with your question, Ben, is my concern is about attrition and caring for healthcare workers as well. We've mentioned over and over again the need to invest in training, and we must continue to do that. But my worry is healthcare workers that are leaving, or are leaving government sectors to work in other sectors. And we've heard in this conference, I've learned a lot about well-being and what that actually looks like from listening to this conference. But it strikes me from what I've heard that a lot of the professional factors that seem to help well-being are very simple things. It's things like people who are specialists being in the right job on the right pay grade and knowing that they're going to get paid every month regularly. And it's not shameful for that to matter to you. Healthcare workers are often people with young families and homes that they need to manage. And my background mostly is in Zambia, and I can't believe the way that the exchange rate between the pound and the kwacha have changed in the last 3 years. The cost of living is astronomical. And I think we really need to make sure that each time a healthcare worker resigns, in a country where healthcare workers are so few in density, the hole that is left is massive. And we've really got to pull together to make sure these incredibly well-trained people and specialists are able to continue to do the job they love.
Thank you so much, Sonia. And we've those themes have been important in this conference, haven't they? About well-being. Particularly Lisa's been helping us think about that. Workforce migration, international recruitment has also been a very big theme of this conference. But David, I want to talk to you about another aspect of the conference that Sonia highlighted, which is to do with power relations between the UK and the overseas partner. But also, can I acknowledge the important insights that we've got into racism in the UK and how that's played out. Professor Mala Rao, the insights from an Unequal World session were amongst my most favorite of the conference. We've published that report, Experts in Our Midst, which looks at how we are undervaluing the NHS diaspora community and the expertise they can bring to health partnerships, to global health, perhaps even to the NHS. We know we're living in a world where gender inequality is still an acute problem, still a challenge we need to address. And so when you see these conversations and these debates, including the debate about where power sits between the UK and the overseas partner, what are your thoughts, David?
Well, it's been very clear in the conference that indeed issues of power are important and critical to partnership work, and you give us some good examples that have come through the conference, including what's happening in the UK, including the minority communities, but also across the globe. We've heard extensively issues of COVID-19 and vaccine inequity and so on. So these are issues that are certainly critical to us all. But I think one thing that comes to my mind is that although things may be improving, looking at how things were in the previous years, there's much more to be done. And I think as partnerships from the global south, I think we also, as leads of such work, need to engage much more and probably be involved and get ourselves more into discussions that actually inform decisions and actually lead to critical discussions and related activities. And I'll give an example. If for example there are discussions concerning which funding is to be allocated to different low and middle income countries and which particular health areas are to be funded, I believe many of the global south partners need to be more involved and their voices be heard more. I think through that way and having more of the global voices on the table actually reduces on the issues of inequality, but also having the shift in power not primarily being held in the global north, but also global south individuals taking an active role. So I think for me, one of the key lessons is that moving forward, there should be involvement and more engagement of partners from the global south, including in discussions that are very high level, but as long as they are going to affect in one way or another the countries in many of these low and middle income country settings.
I think we would very much welcome that. Thank you, David. And I was just thinking about the climate crisis conversation that was happening earlier today, and it is low middle income countries that are disproportionately affected by climate crisis. And that's another reason why we need your voices at the table, influencing the decisions that are made very often without consultation. And let us hope that THET will not, and the health partnership community will not be part of that problem. So David, thank you for those thoughts. Lisa, I'm going to give you the final stage to you, if I may. Lisa is doing a lot of work for us at THET, bringing masses of benefit, and I mentioned the well-being, but also in the development of our strategic plan. It's quite an important period for THET as a charity, and for our role that we carry with humility of facilitating health partnerships, celebrating the expertise across health partnerships. But these conferences are always massive learning opportunities for THET, for the staff, for the trustees, honorary advisors, for the community. Lisa, what's your sense of how we're going to move forward and take some of the insights we've got from the conference and influence the development of our future strategy with those?
Sure. So let me just share the things that are at the top of my head, Ben, because I know that colleagues across THET are going to want to go away, and we'll have numerous discussions collectively about what we've learned. But I think something that holds true to our founder, Eldred Parry, is the vision, the overall vision for the organisation, a world where everyone has got access to quality healthcare. If anything, has just been further reinforced by the conference over the last few days. And our model, our particular USP, something that's very unique to THET, this health partnership model, we've seen the tremendous achievements, and that model will remain. I think, as Sonia said, reminding ourselves of things like the principles of universal health coverage and other things we were working on prior to the pandemic, again, will hold at the centre of whatever we do moving forward. I think thinking about maybe what might change or what we might want to shape going forward, I think we've shown a huge amount of flexibility, and we need to hold on to that, our ability to adapt in a crisis, to hold on to innovation and sort of make sure, I think it was Jonty that used the phrase, that we are sort of tooling ourselves up for the challenges ahead rather than preparing, as generals often do, for the previous battle. So I think keeping that at the forefront of our mind. I think some of the work that we've started around being an anti-racist organisation and valuing diaspora and really exploring some of the opportunities that diversity gives us. I think we've got much more to do on that. We've also just started to become a bit more of a campaigning organisation. You talked earlier about Dr. Tedessa, but I also wanted to mention Dr. Manal Gas from Somaliland, and how humbling, how touched I felt listening to her talk about the inequity of vaccine to vaccine, where we're sitting here considering boosters. And so I think that the role we have as a campaigner, I think, grows for us too. As Marcus mentioned, we've talked a lot about workforce, and I'm going to come back to that in just a moment. But the work around antimicrobial resistance, that continues, and it's wonderful that we've got the opportunity to expand that programme. But new areas that we haven't perhaps explored, and Richard was very honest in the session around climate, that we haven't perhaps got our own house in order on this, and I can see that that's going to be really important for us in coming years, making sure that we're following the science around those that are most vulnerable, often are the most exposed. Also, we heard from Gail and from others about refugees and internally displaced people. Do we have more of a role in convening thoughts and action around that? But I just want to finish by, I think it was Dr. Tedros that said that a common threat needs a united and compassionate response. And I just want to touch on that well-being element, as you might expect, that, as healthcare workers, no one's a hero. We're human. And at the heart of this, we don't have health partnerships. We don't have a health system if we don't look after our health workforce. And so just to bring it back to the three things I think we've learned at this conference: the importance of security and safety for our healthcare workforce, the importance of relationships, institutional or peer-to-peer, and the importance of purpose and satisfaction in our work. We have to continue to focus on those things in order to enable us to move forward with our vision, Ben.
Lisa, thanks so much. What a wealth of insight and what an agenda. Thank you all very much. Thank you, Marcus, Sonia, David, and Lisa, very much for taking part in this panel. Sonia, your phrase, "This is the time of health partnerships," is going to be my slogan. There does feel like a confidence abroad in this conference, a sense that we do have the chance to make a contribution to help make the world a little bit more just, a little bit more equal. I feel very empowered listening to everyone at the end of this conference, hopeful that I can do my part as a foot soldier working alongside you all. So thank you very much. I talked, by the way, about the UK nature, and there are two very exciting conferences coming up. So if you haven't had enough of conferences, do check out the Wales and Africa Health Links Network Conference. That's taking place on November the 3rd and 4th. Frank Atherton, the Chief Medical Officer of Wales, and Sue Tranker, the Chief Nursing Officer of Wales, are speaking at that. And also on the 24th of November, check out the NHS Scotland Global Citizenship Conference. These are great different perspectives that are all part of this broader health partnership approach. So my colleagues are putting, by the way, the links to those conferences in the chat box, which is very helpful. So that concludes the roundtable, and there's just one final duty I have, which is to introduce Professor Judith Ellis, who's known to many of you. Before I introduce Judith, please allow me, in my final words at the conference, to thank my colleagues who have worked so hard in organizing the conference. I'm very much in their debt. But it is an absolute pleasure to introduce Judith. Judith knows that I quite like to be formal on occasions. I want to be formal because, goodness gracious me, Judith has been a THET trustee for 6 years, most of which time you've been chair of trustees. It's an enormous amount of work and time that you've given THET and the health partnership community. And Judith concludes her term at the end of December, and therefore this is the last THET conference that Judith will attend in her capacity as chair of trustees. So I wanted to acknowledge your contribution, but also to say how popular a chair Judith has been. You've been very popular with the chief exec of THET, but you've also been popular with the staff of THET, and for a range of reasons. A couple, if I may mention, is first of all, you've been extremely engaged. So when I think about the countries that you visited and how you've got to know staff overseas and not just in the UK, you've been very actively contributing to the Myanmar response that we were just talking about. Secondly, you draw on immense expertise as a senior nurse, as a former chief exec of RCPCH. So we benefit enormously from your expertise. I think thirdly, I want to say what a brilliant role model you are. So we talked about nursing and acknowledging the importance of nurses at the conference. And you, of course, a nurse. And it's been an absolute pleasure to have you at the top of the organization. But also someone who went out of retirement to work back in the Nightingale Hospital in Manchester when the pandemic happened. So a wonderful role model. And a role model who's been utterly supportive. THET has been through very traumatic months over your tenure. I mean, one day we'll have to write it down, not to let anyone else read, but just to remind ourselves what we've been through. And you've been just so fantastically supportive during that period, which has been crucial to the success of THET. So without further ado, Professor Judith Ellis will conclude our conference. Thank you, Judith.
Thanks very much, Ben. I go very embarrassed. You'll notice I go very flushed. I'm not used to being centre of attention, really. Just ready to say I've thoroughly enjoyed the conference. It's been a real celebration of resilience and solidarity of all global health and care workers. And it's been very moving to hear the discussions of challenges faced: COVID, political unrest, staff wellbeing, intersectionality, all the issues of gender equality, social inclusion. Just amazing. And I think we've all come to shared solutions. I know Lisa used that word, which has been great. But what, above all else, I've been proud of is the invaluable contribution of health partnerships and, in fact, the uniqueness of THET in trying to support that. I think we've come away feeling supportive togetherness is the phrase I came out with at the end of the day. I'm just going to speedily thank people. You've already thanked some of the THET team. I'd like to thank the participants. Using technology does come with a few issues. So thank you all for joining us. That's been great. The speakers and chairs, I'm not going to name people. I tried, and there were lists and lists. I thought, forget it. Everybody's just been superb, and some of you have pulled out their points. And can I just also thank our sponsors, because I'm not sure everybody checked on the site, but please be aware: Health Education England, Florence Nightingale Foundation, Nursing Now Challenge, J&J, Melinda Gates Foundation, King's College London, NHS Scotland, Global Citizenship, Public Health Pathways, and Action for Global Health. I purposely am reading them because just in case people haven't looked. And then the THET staff. You are just amazing as ever. It has been seamless in spite of losing signal. This is my last year. I've done 6 years as chair. And Ben did ask me, but I'm aware of time, just to reflect a little bit on the time as chair. Just to say, when I applied, I didn't think I'd get it. When I did get it, I was scared silly because I didn't want to let Eldred down. And it was approached with great trepidation because that was such an important organisation to me. But to be honest, it's just the role of a chair is easy. I say I conduct the orchestra. I'm the conductor. They say I'm the leader. It's not been difficult to lead. The trustees, who I would like to thank, and I know we haven't got much time, but just to thank, throughout my time, I've had 11 trustees working with me. They've all been phenomenal. They are calm, professional. They don't panic when under stress. And Ben's absolutely right. We've had some crackingly stressful times. We won't mention the FCDO again, but we might. And we've had a new strategy going forward. We've become more multidisciplinary. Health systems strengthening has taken on a new importance over the 6 years, and indeed the use of technology. And I know Lisa talked about sharing. Pulse is an incredibly good way of sharing. Please use it. So yes, the trustees have been great. And the most exciting thing for me, and COVID brought this about, was actually now having trustees from Jemima from Ghana and Rhoda from Somaliland. That has changed the way we work. And in fact, if we hadn't gone totally Zoom as trustees, we may have hesitated. We've now learned to have those inclusive, real equality of the input of all our trustees. And then one of the trustee roles on the Charity Commission side is to supervise and support the chief exec. Yeah, okay, Ben. Well, we've more been a partnership in this, if I'm really honest. There have been times we've had to pull each other through. And there have been good times and there have been tricky times, but we've never not been partners in that. And I thank you for that. The other thing is the staff. Amazing group of staff. I sometimes feel a bit old, if I'm honest. I'd have to just say I feel a bit motherly towards them sometimes, particularly in the stress when everybody was working at home and COVID was going on. But they have just been great, and not just in the UK. The country offices, you say I did take some trips out. They speedily say self-funded. I don't want to think we use that money, but seeing the on-the-ground work of these people, meeting the ministers and director generals in these countries, hearing firsthand what that's meant to them, has been just incredible. And the other thing they tell me to be as a charity chair, as a figurehead of the charity. I'll be honest, Eldred is our patron, our founder, and has been our figurehead throughout. And Lord Crisp, Nigel is our patron. They have done a wonderful job, and I've really just filled in when they couldn't. I'll be real, it's not the bit that I love, and they have been superb. But thank you for all that. Challenges, very speedily, we've had loads. Safeguarding became a major challenge with Oxfam. We knew we were safe and secure, but we needed to make sure our policies were there. We needed to make sure every partnership that worked with us had good safeguarding. All the governance of working in countries, very complex, HR policies, political instability, how we manage money. Somebody talked before about exchange rates, getting money in and out. Working in countries is not easy, and Thet has managed to crack that. We went up to 10 country presence. That was an amazing thing to do. And we've been fleet of foot, which is why in COVID, I know Victoria praised us for that. And that's partly because those systems are now in place. Biggest challenge, finance. At the end of the day, as a chair, you have to make sure the finances are sound. And we have struggled at times. We were very reliant 6 years ago on Foreign and Commonwealth Office money, DFID money, and we knew that couldn't continue. And thank goodness we did feel that, because otherwise when FCDO had that horrific decision earlier in the year, which was probably the worst week of our lives, if I'm honest, partly because I worried so much about all the partnerships. But we have diversified, and we've had to prove that we're worth funding. So we've had to prove that we are safe custodians of the money. We've had to prove we do what we say we'll do, and we have to prove that we have an impact. And then we got the issue of mutual benefit. You know, COVID hits, charity begins at home. Why should we be sending money abroad? We were fighting the corner all the time. And in fact, gratitude to all the people who continue to support us and have broadened our financial state. And I won't list them all because they know themselves. But it's been great. And it meant when FCDO did pull, we were not in such a down position. One of the biggest challenges has been making sure all the money we get isn't restricted to projects. That was in a situation where there was no core money to run Thet. If we don't have core money to run Thet, then we can't put bids in, we can't support people. And like when FCDO money was pulled, we'd have been in a sorry state. And it was good news that in 6 years we have managed to get stabilisation of some of the money, not all, but enough unrestricted money to actually run the organisations and to have reserves as a buffer. And that has increased and improved. And I can thank Claire as the finance trustee for reading that, and staff who are coming into post has got us into that state now. So challenges continue. But Pet's gone from strength to strength. We're punching way above our weight. People say, you know, are you big? We're not a big organisation, but blimey, are we known? And that is due to the efforts of Ben and the team and the good practice. We've got toolkits out there for good practice. We talk about principles of partnership, safeguarding, Jesse, all the recent work on intersectionality. And then the policymakers, they now look to us, and that's because of our policy team. You know, we started with our mutual interest in my time, transition from aid, from competition to collaboration. I could list them all. They all go forward. And THET has become our friend. And their friend in politics. So we are resilient. We're much more resilient than we were 6 years ago, which is great. We've got solidarity from all our supporters. And I think the power of partnership, the power of THET has really been proven in these times of COVID when we've been able to rapidly support. So just final 2 seconds. When new staff start at THET, the email I always send is welcome to the THET family. That is what we are. We're small enough to be that close family. We support, we care about each other, we care about our partners. I'll really miss being the governance head of that family, but 6 years is all I can do, and that is how it is. But I absolutely feel confident that that's now going to carry on going from strength to strength. So thank you all very much indeed for all your support. It has been an honour, a privilege, and I wish you well. I'm sure I will continue to be involved, but I wish you all well. Thanks very much.